So I'm just going to come in and do a primary assessment on this patient. So when I approach the patient, the first thing, this is more applicable for a trauma patient, but also good for any patients. You want to make sure there's no uncontrolled bleeding. That's going to be your first priority to take care of if that's present. So I don't see any uncontrolled bleeding, and then I want to assess the patient's level of consciousness. So I'm going to see if she's spontaneously alert, so if her eyes are open and looking at me and interacting with me. If not, then I would say her name or try to get her to respond with some verbal stimuli. If that doesn't work, then I would elicit some painful stimuli such as a trap squeeze or some painful nail bed pressure. So that's just your AVPU scale. If they're conscious to, if they're spontaneously alert or alert to verbal painful stimuli or not alert at all. The next thing I'm going to take a look at is her airway. I just want to make sure that there's nothing in her airway and that I don't hear any weird abnormal sounds coming from the airway to make sure that's clear. I'm going to grab the patient's radial pulse and feel that. I'm feeling for how fast it is, not necessarily a number, but whether it's too fast, too slow, or about normal. How strong the radial pulse is, and then if it's regular or irregular. Same time, I'm going to be feeling her skin condition, so I want to know if it's warm or cool, if there's any moisture in the skin, or if it's dry, and then I'm paying attention to her skin color, whether she's pale, flushed, things like that. I'm then going to pay attention to her breathing, so I want to note how fast she's breathing. Again, not a specific number, but does it look too fast, too slow, or about normal? What the effort of her breathing is, so labored or non-labored, and then how deep her breathing is, whether it's shallow or an increased depth. I'm then going to listen to her lung sounds. So we're going to listen in the upper lobes first, at least for one full breath, and then I want to compare side to side. So I'm going to listen to the two upper lobes first, comparing, and then I'll listen to her lower lobes, maybe a little bit over to the side here, also comparing side to side. And then you can also listen to the posterior lung sounds, but they're the same lungs, so it's really not necessary. You can listen to front or back, but not necessary to do both. And that pretty much concludes your primary assessment.